Welcome to the deep dive. You've handed us, well, a mountain of research on autism.
Yeah,
Which is amazing, but it can be a lot to process.
it really can.
So we're going to zero in on a connection that might surprise you.
Yeah.
Autism and grand mal seizures.
You're right.
Yeah.
It's not exactly light dinner conversation,
Right.
but it's a connection that's way more common than a lot of people think.
Right. So before we get into the why, let's make sure everyone's on the same page.
Okay.
We're talking specifically about grand mal seizures.
Mm-hmm.
What are we picturing when those happen?
Basically,
Yeah.
think of it as a major, neurological event.
Okay.
A person loses consciousness, their muscles tense up, they might even collapse.
Wow.
It's the kind of seizure that, sadly, often makes it into movies and TV,
Yeah.
not always accurately portrayed.
And to put some numbers to it,
Yeah.
how often do we actually see this link between autism and these, intense seizures?
Hold on to your hats for this one. Studies estimate that about 25 to 30%, so a quarter to a third of people with autism will develop epilepsy.
Wow.
And within that group,
Yep.
grand mal seizures are one of the most common types.
So almost a third of people with autism are experiencing these dramatic neurological events at some point in their lives.
That's what the research is suggesting, yeah.
That's a huge GE number.
Yeah, it's significant.
So knowing that this connection is that prevalent, I have to ask, what is going on in the brain?
Right.
Why does this link between autism and grand mal seizures exist?
If the brain were a simple thing,
Yeah.
we'd have it all figured out by now, wouldn't we?
Right.
But the truth is it's complex.
Yeah.
We're still connecting the dots.
Yeah.
But there are a few big pieces of the puzzle we're starting to understand.
Okay, let's unpack this puzzle then.
Yeah.
Where do we even start?
Well, with so many things related to, how our brains work,
Hmm.
genetics plays a big role. Both autism and epilepsy have a hereditary component,
Okay.
meaning they can run in families.
So there's a chance that someone might inherit a genetic predisposition for both conditions.
Exactly.
Oh.
It's not as simple as, one gene equals autism, another equals seizures.
Right.
It's more like inheriting certain variations that might make someone more susceptible to both conditions.
Okay, so that's the genetic piece of the puzzle.
Mm-hmm.
But you mentioned there was more to this brain connection, right?
Absolutely. And this is where it gets even more interesting.
Okay.
Research has shown that there can be subtle differences in the brain structure
Okay.
and function of individuals with autism.
Interesting.
Again, not necessarily a bad thing,
Sure.
but these differences could potentially increase the likelihood of experiencing seizures.
So are we talking about, specific areas of the brain here?
Well, research is ongoing and it's very individualized.
Right.
Some areas that seem to pop up more often are the cortex, which is the brain's outer layer responsible for things like thinking and processing information, and the hippocampus, which plays a vital role in learning and memory.
Right.
These regions sometimes show unique characteristics in individuals with autism, which could relate to the increased occurrence of seizures.
So it's like a complex interplay between these subtle brain variations and the genetic predisposition that might create a kind of perfect storm for seizures to occur.
Or perfect storm, that's a great way to put it.
Yeah.
But remember, it's not as simple as saying,
Right.
if this brain difference, then seizure.
Yeah.
It's about understanding that these variations can increase the likelihood
Right.
within a whole web of other influencing factors.
And are those other influencing factors what make this whole thing even more complicated?
You got it.
Okay.
It's like a recipe where just one ingredient can change the whole outcome. Think of it this way.
Okay.
Some individuals with autism also have other conditions,
Right.
like intellectual disabilities or certain developmental delays. And these conditions, on their own, can also increase the risk of seizures.
So it's not always the autism itself,
Right.
but sometimes the company it keeps.
Yeah,
That adds to the complexity.
precisely. And to add yet another layer of complexity, we have to remember that every individual with autism is unique.
Of course.
What holds true for one person might not hold true for another.
Okay, so this is all starting to make sense from a root cause perspective.
Okay.
But let's talk about what this actually means for someone living with both autism and grand mal seizures.
Well, the first thing to highlight is that recognizing seizures in autistic individuals can be tricky.
Really?
Yeah.
Okay.
Some of the more subtle signs of a seizure, like
Yeah.
staring spells or brief moments of confusion,
Yeah.
might be mistaken for autistic traits.
Oh, interesting.
or even just individual quirks.
That's a really good point. It's like trying to hear a whisper in a hurricane.
Ex-
With so much going on, it can be easy to miss those, like, more subtle signs.
Exactly, and that's why awareness is so important, because
Yep.
early identification is key.
Of course, yeah.
The sooner someone can get a diagnosis and start appropriate treatment, the better their outcomes are likely to be.
So let's say someone is having frequent grand mal seizures.
Okay.
What does treatment even look like?
Yeah.
Is it as straightforward as, here's some medication, you're all set?
I wish it were that simple.
Yeah.
But unfortunately, it's rarely a one-size-fits-all situation.
Yep.
Managing seizures, especially in the context of autism, usually involves a whole team of specialists working together.
Wow.
You've got neurologists who are, experts in brain disorders, potentially behavioral therapists to help with any anxiety or sensory issues that might be related to seizures,
Yeah.
and maybe even occupational therapists to address any physical challenges.
Okay, so it sounds like managing grand mal seizures, especially in the context of autism, requires a pretty comprehensive approach.
It does.
Yeah.
But even with a solid team and treatment plan,
Yeah.
there's still a lot to navigate.
Okay.
For example, some anti-seizure medications, while effective, can sometimes have side effects that interfere with other therapies,
Oh, wow.
or even exacerbate certain autistic traits.
So it's a constant balancing act of finding what works best for that individual,
Exactly.
while also considering all these other factors.
Yeah.
It makes you appreciate the dedication and resilience of both the individuals and their families who are navigating this every day.
Absolutely.
Yeah.
It's a testament to their strength and commitment to finding the best possible path forward.
It's definitely a lot to consider.
Yeah.
And speaking of things to consider, we've been like laser focused on grand mal seizures.
Right.
But you mentioned earlier that there are actually tons of different types of seizures.
Oh,
Is that-
absolutely. Grand mals tend to kind of like steal the show because
got it.
they're so dramatic.
Yeah.
But there are over 40 recognized types of seizures, and they can manifest in a surprisingly wide range of ways.
Okay, so for those of us who aren't neurologists,
Right.
could you paint a picture of what some of these other, like maybe less dramatic seizures might look like?
Yeah.
Especially for someone with autism.
Absolutely.
Okay.
Imagine for a second a child in a classroom who suddenly seems to just like zone out,
Okay.
staring blankly into space for a few seconds.
Mm-hmm.
Maybe their eyes flicker or their lips smack a little. To the
Right.
untrained eye, it might look like they're just daydreaming, right?
Right, yeah.
But that could actually be an absent seizure.
Wow, so easy to miss,
Yeah,
especially in a busy classroom setting.
absolutely.
And you're saying that for someone with autism, these like subtle signs might be even harder to pick up on.
Exactly.
Wow.
Because some of the behaviors associated with autism, like difficulty with social interaction or, repetitive movements,
Right.
might overlap with certain types of seizures.
Yeah.
It can be very tricky to tease apart what's like typical for that individual and what might be a neurological event.
So if absent seizures are the like blink and you'll miss it version,
Right.
what are some other examples on the other end of the spectrum?
Well, there are myoclonic seizures, which
Okay.
are characterized by these sudden, brief muscle jerks.
Okay.
Someone might twitch unexpectedly, drop something they're holding,
Yeah.
or even appear clumsy.
I can see how those could easily be mistaken for just like everyday clumsiness,
Exactly.
especially in kids.
Precisely.
Yeah.
And that's why, this deep dive is so important. It's about raising awareness
Yeah.
that seizures in all their forms can present differently in individuals with autism.
So if a parent or caregiver notices something that seems off,
Yeah,
even if they're not quite sure what it is,
right.
what should they do?
Never hesitate to consult with a doctor or neurologist.
Right.
It's always better to err on the side of caution. And when it comes to seizures, early identification can make a world of difference.
Yeah.
In terms of managing the condition and improving quality of life.
That's such an important reminder.
It is.
It's about being like proactive and advocating
Yeah.
for the individual's well-being.
Exactly. And the
Yeah.
more we understand about the connection between autism and seizures, the better equipped we'll be to provide the right support and care.
This deep dive has definitely given us a lot to think about, from the genetics behind this like unexpected connection to the importance of recognizing those sometimes like hidden signs of seizures.
Yeah.
It's a complex topic, but knowledge is power, right?
Absolutely.
Yeah.
And the more we know, the more we can empower individuals with autism and families
Right.
to navigate these challenges and lead fulfilling lives.
That's a perfect note to end on.
It really is.
Thanks for joining us on this deep dive.
My pleasure.
For our listeners, we encourage you to keep exploring, keep asking questions, and keep advocating for those who need it most.